And with new developments in the fight against the coronavirus today, health officials will vote during an emergency meeting on who should first receive the coronavirus vaccine once it's approved.
In the meantime, hospitalizations have more than doubled since the beginning of November. 23 states are seeing record numbers at this point. Channel 2 health reporter Haley Hernandez joining us now with a closer look at how the Texas Medical Center is preparing for a possible surge of cases. Haley?
Yeah, Christine, so I spoke to a lot of the hospitals within the medical center, and as you know, their systems reach 9 counties across our area. Each one says we won't know the effect of Thanksgiving gatherings for a couple of weeks. But what we do know is that the numbers are not going in the right direction.
At Memorial Hermann, they say they are planning for a significant rise in numbers because of holiday gatherings.
I think we're going to see a shift in the age because of family units gathering and folks who've been really careful kind of.
While the emergency room at Ben Taub says their ICU capacity is manageable, but as cases continue to climb, that will certainly change. The same grim warning comes from Methodist, who says almost 400 of their hospital beds are currently occupied by COVID patients. And since recently getting approval to administer an antibody concoction, they said they treated 24 patients with it on Friday alone.
The outcomes from hospitalizations have improved, and we've gotten better at taking care of patients. My concern would be that right now we have a limited supply of these medications to give people. So I think we're going to come up short if we continue to have a escalating infection rate.
St. Luke's says we have learned a great deal throughout the COVID-19 pandemic that informs our preparation for the next potential surge. They have detailed plans in place to expand critical care capacity should we need to do so. Now, we know one method to doing that is transforming regular hospital rooms to ICU rooms in the event of a disaster. It's a plan, of course, but one no doctor wants to see happen.
The staff are tired. We are tired.
But we really need a community to cooperate with these measures to help us slow the spread.
Now, after big events like holidays, the charts typically don't show an increase in cases directly related to that event until 2-3 weeks later. So while the numbers are rising, we really haven't begun to see an increase that can be blamed on Thanksgiving yet. Christine?